Welcome to Aging Untold. For so many families, wandering isn't just a medical term, but a lived experience. You've heard the stories before. Every evening, like clockwork, mom or dad who has dementia begins pacing the hallway. And if they're not closely watched, some find their way out of the house without warning. Let's talk about wandering and what makes this so concerning. So, Dr. Ray, what's going on mentally that leads to this?
Well, the brain is struggling to interpret the world and meet a need and to feel safe. There's many regions in the brain, there's some lobes, but one particular one is called the hippocampus. And that's part of the temporal lobe that helps us to remember, orient ourselves, and to know where we are in that time and place. And that's one of the first areas that gets hit with Alzheimer's dementia. So think of it like its own internal GPS. So the brain, when it gets overstimulated or there's fear or anxiety, it just can't explain the problem. So when people are wandering, they're trying to fill that need. They're trying to explain something. And so it can be dangerous because of falls, stimuli to the cold and outside and getting lost. But just remember, as a caretaker, try to figure out what that need is they're trying to fill. So are they in pain? Do they want to eat? To use the restroom? There's usually an underlying thing for why they're wandering.
Exactly. And I always tell caregivers that the feet are doing the talking. So sometimes your mouth can't verbalize. You can't come up with the words of what's going on. Maybe you can't say I'm hungry. Maybe you can't say I need to go to the restroom or I'm in pain. So your feet are actually what's doing the talking for you. And a caregiver needs to anticipate what that need is well before the feet take off. You might not be able to write the word stop and have somebody understand that as the brain gets changed. But put a stop sign up on the door. That is a universal symbol that says stop. It's a red stop sign. Put it there. It will literally stop some of this process. There are so many things that we can do. And if they are going to wander, make sure you have a tracking device. And don't put a tracking device in their pants pocket. Put it on their shoes. People don't wander off without their shoes on usually.
I was remembering a client that was in a community that I worked in, and she had a suitcase in her room, and every day she wanted to go to Teaneck, New Jersey. She wanted to go home. So we took the suitcase out of the room, and she stopped doing that. It's like something so obvious. And then I was remembering another couple. The wife had Alzheimer's, and they called me for help, and I went out there to help. And he had done just what you were saying. Stop sign on the door. Then he had right turn only, then a left turn only, and he was managing her wandering with just some really simple, this is back before any of the complicated technology was out here.
Right, and it's those visual cues. Lots of people get really caught up in, well, I'm gonna write them notes, and I'm gonna leave notes on cupboards, and I'm gonna leave notes on doors. When was the last time you saw somebody with advanced dementia reading a newspaper? So the words aren't making sense anymore, but those symbols still do.
The Alzheimer's Association and Medical Alert, they combine to create a program that you can label them, and if they're found, they have a national database, little bracelet, and so if someone finds them, all they need to do is get the information on the bracelet, and they'll be able to find them no matter where they go in the country.
That's terrifying because you don't want them out. Because, that is like the most horrifying thing that can happen to a community, that they've let somebody's grandma or grandpa out. And it's really, really scary. And if you're still living at home, another symbol is that main caregiver, which oftentimes is the spouse, and the anchoring that occurs. And if that spouse isn't there, that caregiver isn't there, they're looking for them. So sometimes they're exit seeking, like, where did she go? That is very, very difficult to be anchored to. And there's so much guilt over leaving just for a quick appointment. And so that's really a very difficult thing with caregiving. And sometimes people don't want to let their loved one go to memory care or bring people in to help, but you really need it to protect yourself.
Right. And then have a plan when they do wander. What kind of support can you pull on? Do you have somebody that can find them? They have so many sophisticated apps now. I was talking to a woman yesterday, and she was telling me about this watch, and they've got an app. And so anytime her dad goes somewhere he shouldn't, she gets a call. And then she can actually talk to her dad. So there's ways to, if it happens, keep yourself protected, and then you might be able to delay hiring expensive care before you need to.
I tell every family, have a safety file, have a current picture, have a safety file that's available if they get out, if you've lost them. And it happens. It's unfortunate, but it does happen. We've got 60% of most dementia patients will wander at least one time. So this is not an infrequent thing. So that safety file, you can hand that over to the authorities. They can get that out there. There are silver alerts now that let people know that there's someone out, and let your neighborhood know, because typically the wandering isn't very far. It does happen where there's occasions where it is, but typically they're not traveling 5 miles down the road.
Yeah, and I think the biggest thing is don't wait until it happens. You know, we know that these things are going to happen. So let's start planning in advance to come up with a strategy that's going to work for each family, because that's where you are the healthiest. So you stop all confusion, everybody's on the same page, and you know what's going to happen before a crisis.
Yeah. And one of the best things you can do is look for local people that can be great resources to help you with these tips as things go on.